share my screen. And today we're going to talk about the truth about timeout, science-backed techniques for better parent-child relationships. And I love seeing so many familiar faces. Some of you great PCITers out there would love to say hello to everyone, but we just don't have time. So thank you all for being here. Okay, so what you might be thinking in this moment coming to this webinar. Some of you are thinking timeout is really cruel. It is harsh, it is isolating, it upsets children, it damages them, and you may be worried about using it or recommending it for use with the families you work with. Others of you might be rolling your eyes like Tina Fey and saying that timeout, yeah, right, that doesn't work for my kid. It's not enough. I've tried it. I just not going to use it, or my kids' issues are way too severe for it, or the kids that I work with, it just can't work. Some of you might be timeout believers because you're timeout researchers, but I am not here today to convince you how to raise your kids or of what is best for you. I am just your intermediary between you and the research, because I am trained in how to interpret this research, specifically in child psychology, in parenting literature. And so I can interpret for you what the science tells us. I can't tell you what's right or wrong to do. I can just tell you the facts. So your opinions and your decisions after you hear this talk, just like before you hear this talk, are totally up to you. But according to the scientific data, neither of these opinions, timeout is cruel or timeout doesn't work for my kid, is true. If it's done correctly and done in a therapeutic way as part of a larger child-parent relationship that's positive and has lots of attention and lots of access to positive activities. And that's probably my biggest takeaway here is timeout is not meant to fix relationships. It's not meant to solve all problems. It is a tool as a part of a larger parent-child relationship that is full of a lot of other healthy ingredients. So I want to give some disclosures here. I do have some intellectual property. This is the book that Lindsay was talking about that I wrote with Dr. Cheryl McNeil, who is one of my mentors and a very, very well-known child psychologist in this space. And I also have some research funding for studies on timeout and treatments that include timeout. I am 100% here not here today to sell this book. I make very, very, very small percentage of this book sales. I didn't publish it to make money. You can buy it on Amazon. It's pretty cheap. It's between $20 and $30. I published it mostly because I wanted this information to be out there, because with social media and the internet and all these like short sound bites that are published all the time, parents who want to do well are getting misguided on what the facts are. And so that was my major goal for people who read it. It's written more for therapists, professionals. It's very like dry and sciencey. It's not like a quick, fun parenting read. So just wanted to throw that out there. So today we're going to talk about what's the evidence supporting the use of timeout for behavior management in young children. You are going to be able to, at the end of this, identify strategies for appropriately tailoring timeout to components of your family or other families' unique cultural and developmental needs. And you'll have a better understanding of the controversial legal and ethical issues around timeout. So before we get started, I wanted to define for us the scientific definition of timeout. The full definition is timeout from positive reinforcement. And reinforcement can be things like attention, activities, or things that kids are attracted to, like, enjoy, whatever. In research, positive reinforcement, positive doesn't mean good or fun. It just means that you're adding something. So if your kids are riding together and one of your children says to the other, "Stop touching me," and then her sister immediately touches her, technically that is positive reinforcement. She's adding the phrase, "Stop touching me," and it made the behavior of touching happen again. So it's positively reinforcing that behavior. I know that's a very technical thing, but it's just important to keep in mind as we go through this talk. So the point of timeout from positive reinforcement is that it's creating a contrast for the child between all the reinforcement they're getting throughout the day. They're having great conversations with their parents, they're doing lots of fun activities together, and all of a sudden that goes away for a short period and it's boring. We don't want timeout to be scary or full of shame or awful. We just want it to be more boring than the other things in the environment that the child usually has access to. And when we use it in that way, timeout is effective. So the research says that as it's on its own, when we study it on its own, doesn't mean we're using it on its own. We're using lots of other positive parenting strategies. But when we study timeout on its own, it's effective in reducing behavior problems. It's also effective as part of larger treatments. And we'll talk about that next. It is effective across lots of different types of behavior. It's effective in different settings, and it's effective across different populations. So when we talk about timeout as part of a larger treatment, there are so many treatment models that are used around the world. Here are a few examples. These are evidence-based treatment programs. So they've been studied rigorously in clinical trials and shown to be effective for kids. And so a lot of these are called behavioral parent training programs. I am trained in parent-child interaction therapy, PCIT on the bottom right. Lots of you on this call, I can see, are also trained in PCIT, and we do use a therapeutic timeout as part of our treatment here. So you could look up any of these treatments and learn more about them. I also want to say that timeout is recommended and has been since 1998 by the American Academy of Pediatrics. It's also recommended by the Centers for Disease Control, the American Psychological Association, Society of Clinical Child and Adolescent Psychology, and by the Association of University Centers on Disabilities. So it is effective across behavior. Here are a few examples of the types of behavior that timeout has successfully been used to target in the research. I would say most commonly we're looking at decreasing noncompliance or aggression, basically helping kids learn how to follow directions better. But in general, lots of other things that can be used effectively for. It's across settings. It's been used school, home, specific institutions. Here's some examples. And it's also been used in a variety of populations. So different types of presenting concerns, diagnoses, and we'll talk more later about the different cultures and locations it's been used successfully in. But I guess the takeaway here is that you shouldn't be concerned that, oh, because my child has autism, timeout might not work for them, or, oh, because my child has an intellectual disability, timeout won't work. It has been shown to be effective, regardless of diagnoses. Okay, so you might be wondering, how do I give a good timeout? What is a therapeutic timeout? What is the right way to do it? And so when we were writing our book, we looked through the literature, and there are about 8 different categories of things that have been studied, components of timeout, and we have a little bit of evidence on each one about what's the best option. So the first question is, should I give a reason? For example, if I say, you hurt your brother, so you have to go to timeout, that's giving a reason. So giving a reason, according to the research, doesn't really make a difference in terms of how effective it is. If you just say, go to timeout, or if you say you hurt your brother, so you have to go to timeout, either way, it's equally effective at reducing hurting the brother. However, some of the research shows that caregivers prefer to give a reason because it feels more respectful and more kind and understanding of your child. And the only issue here is that we don't want to give a reason during the timeout. So once that child is sitting in timeout, you don't want to go over and explain, the reason you're over here is because you chose to hurt your brother. And if you keep doing this, you're going to get more timeouts. That piece is not timeout from positive reinforcement. That piece is actually giving attention during the timeout, and that will make the timeout less effective. So you can give a reason prior to timeout if you want to. It doesn't change whether or not the timeout's going to work, but it might be more more enjoyable, more palatable for you and or the families that you're recommending this to. Question number 2, should I give a warning? So according to the research, giving a warning, and warning is different than a reason because a warning is like saying, if you don't pick up your shoes, you'll have to sit in timeout. So it's giving them like another chance. It's a prompt that maybe the timeout's not going to happen if you change your behavior. There are 4 studies that specifically compared warned and unwarned timeouts. And we know that it doesn't make a huge difference. They're both effective. But if you give a single warning before you actually go to the timeout consequence, you're going to end up with fewer timeouts because that child has a second chance to turn their behavior around and you don't have to go through the whole timeout procedure. What we don't want you to do is give multiple warnings because according to all the studies, if you give 2, 3, 4, 5, 6 warnings before the timeout, it is going to lead to actually more problem behavior than if you just give 0 to 1 warnings. And I think as parents, we've all been there. We give a couple more chances if we're in a good mood, and we just want to shy away from doing that. Stick to one or 0 warnings. How do I get my child to time out? So either telling them, walk to timeout, go to timeout, or carrying them are equally effective according to the research. Sometimes you can't physically carry a child there. If you've got a caregiver who is unable to carry their child for whatever reason, if you've got a bigger kid like that you can't pick up, or if your child, on the other hand, doesn't understand what go to timeout means and you're going to have to pick them up and carry them over there, you're just going to have to decide sometimes. But the good thing is that they're both equally effective, but we've only got a very small number of studies to show us this. So we need to have more research. And when I'm talking about the number of studies on these things, I'm not talking about the number of studies that show that timeout is effective. I'm talking about a specific study that compares carrying a child versus telling a child to go to timeout. So there's tons and tons and tons and tons of research that timeout is effective. It's just there are fewer studies comparing these 2 very specific components of timeout. There is one study that shows that timeouts could be shorter if the child walks there by themselves than if they were carried. But still, in that case, both of the timeouts types were effective at reducing whatever the behavior problem was, like hitting. I know this is very technical and confusing stuff, but these takeaway points on the slides are what I want you to keep in mind. Where is the best location for timeout? So we've got 3 different categories in the research, and I'll go over each one. So the first one is removing the child. This is like a go to your room or sit in the hall. You're having the child leave the environment they were in and all of the reinforcement that they had access to. So all the attention in that room, all the things and activities in that room. We've got option 2, which is just separating the child. This is like a sit in the corner or sit in a chair in the room. So you're separating the child from the source of some reinforcement, like maybe she's not getting as much attention from her peers if she's sitting off to the side in the room, or maybe she's not getting access to playing the game that she was playing because she's moved, but she's not getting out of the task that she had to do. So maybe she's supposed to be working on a worksheet here. She can still work on her worksheet in the other area. And so this type of timeout is a little bit more feasible. Sometimes if you've got a lot of kids, if you're in public, if you're a teacher. And then the last type is just a timeout in place. And so an example of this would be like taking a timeout for the toys that the child's playing with. Just ignoring that child's behavior is technically a form of timeout, or they're still staying where they are, but they can't participate in the activity they were participating in. So perhaps the teacher's giving out points for certain types of behavior, and now that child can't earn any more points until the timeout is over. But the point of this one is that the child's still in the environment, they're still with whoever they were with. So they get to watch other people getting reinforcement. They get to watch other people getting called on for raising their hand. And so they're learning by modeling kind of what is expected and what they're missing out on until the timeout's over. So we have three options, doors number 1, 2, and 3. And the answer is super complicated. But at the end of the day, there is very little evidence that a more restrictive option, so like a number 1 would be the most restrictive, completely removing the child from the room, that works any better. And so our recommendation based on this research is to use the least restrictive option that can still be completed properly. And by properly, we mean giving that behavior a timeout from the type of reinforcement that kept that behavior going. So if you are saying potty language in your chair at school and everybody's laughing every time you say something, if you can move that child to another area of the room, or even get the kids to stop laughing at that behavior, we're properly removing reinforcement for that behavior. And so that can be effective. And we don't have to go the full route of sending the child to the principal's office. So if you can do it and successfully remove reinforcement for that behavior, then do it, because it's going to work just as well. However, there are some studies that show that removing the child makes the behavior change happen quicker. So they kind of learn their lesson a little bit more quickly. And that removing the child, like option 1, helps them, that effect last longer. So they're going to remember that lesson for a little bit longer. Yeah, that's all I'm going to say about that one. Very complicated, all the different studies on that one. How long should timeout be? This is a question I get asked a lot in clinic. There is little research evidence that there's any effectiveness gain going beyond 5 minutes. There's really no magic formula for knowing the exact number of minutes to use under 5 minutes, because in the research, there's lots of different situations, settings, and individuals that were studied, and different outcomes for different amounts of time. We do use a 3-minute timeout in parent-child interaction therapy that has a lot of research evidence to support that's effectiveness. A fun fact I like to share is that there is no evidence to support the whole timeout is the number of minutes for the child's age. There's nothing wrong with doing that. However, if you've got an 8-year-old and you're waiting 8 minutes to complete timeout, and you could get the same effect at a 3-minute timeout or a 5-minute timeout, it's just a lot more burden on you as the caregiver, on the child to have to sit still, and you may be less likely to use the timeout consistently if it's such a big hassle. So less is more on that. There is a small amount of research showing that timeouts that are short, given right after a timeout that's long, is a little bit less effective. So you just want to be consistent in how long you're doing it. So if you have a really long timeout and the child experiences that, and then they have a real short one afterwards, they might not have that behavior change happen in the same way. When should I enforce timeout? We want you using timeout every single time a target behavior happens. If you can be really specific in your target behavior, like telling your child they're going to get a timeout every single time that they hit, or every single time they say a cuss word, versus just getting it for being bad, then you can be more consistent in when you give it every single time. However, we know that all of us parents, caregivers, are not perfect. There are some days when you just can't follow through. There are sometimes when you are a little bit more lenient. And we know that even when it's delivered less consistently, it can still work pretty well. The studies show that obviously timeout works better if you're using it every single time. But in cases where they've tried using it, not every single time, it can still make a big change in the behavior. How do I end timeout? There are 3 different categories of research that are out there on this topic. The first category is time. So like we talked about, you're setting a certain amount of time, regardless of the behavior. The child could be yelling in the timeout chair. They could be throwing things at you. But as long as they complete their 5 minutes or whatever, then timeout's over. The second option is child behavior. So this would be like well, when you're ready to apologize, you can come out. Or when you have finished a certain chore, then you can be done with your timeout. And then the third one is a combo of the first two. So in PCIT, for example, we use a 3-minute timeout, but the child has to be quiet for at least 5 seconds at the end of timeout before it can end. So it's just different ways of doing it. The goal with that approach is that we don't want to reward the child for screaming or saying something inappropriate at the end of timeout and thinking that that's why they got let up. But all of them have shown effectiveness. There is no clear winner, but there's only a small number of studies that have shown any change for the option 3. So I hate to say this to the PCIT researchers out there, but there's not overwhelming evidence that waiting that 5 seconds of silence at the end of timeout makes a huge difference in changing the problem behavior. So in the hitting or whatever we put the child in timeout for originally. However, I think a lot of people say, well, we know that both ways will work in changing the child's behavior, but we want to encourage the child to sit quietly and calmly in timeout. And even only a small percentage of the studies show that the behavior in the timeout chair changes if we worry about staying quiet at the end. So no clear winner, but if we can pick a less complicated version of timeout for families, they may be more likely to give it in the proper way, which is in a boring way, basically. What if my child escapes from timeout or refuses timeout? Escapes is like the scientific word. It sounds very nefarious. But basically they get up before they're supposed to, or you tell them to go to their room and they leave before they're supposed to. You want to have a boring backup plan. These are, according to the research, very crucial for timeout's effectiveness. If you try to put a child in timeout and they just leave it immediately, you lose a lot of your effect. So backups commonly can be a loss of a privilege or having to go to a different environment. Maybe you're allowed to sit on the stairs or you're allowed to sit in a chair, but if you don't follow the rules there, then you actually do have to go to your room. And we just want to avoid any physical interactions if possible, just because when parents are upset and kids are upset, the tendency to yell and get in each other's face and grab too tightly and sometimes even physically hitting or abusing just go up when we're close to touching each other. So if you can at all possible, use a backup plan that doesn't involve touching. Okay, this is a different version of the same question. What if my child escapes to timeout? So you say, if you don't lie down, you'll go to timeout. And the kid thinks, well, great. I don't want to lie down in this room where it's dark and boring and no one's in here with me. I'd actually rather go to timeout because timeout's out there with you guys and I get to stay up a little bit later. So they're basically using a timeout to get out of a task that they're supposed to be doing. So we want to make sure that this doesn't happen. Using timeout as an escape for kids makes it far less effective, according to the research. And so in a good therapeutic timeout, we want you to require the child to do a task that they were originally told to do at the end of timeout in order for the whole deal to be done. So if you had said, go pick up your shoes, and the child really doesn't want to go pick up their shoes, they'd rather sit in timeout, then that's fine, but they're going to finish picking up their shoes before the timeout is over. Or if it's a situation like going to bed, timeout just might not be a good fit for that situation. You could do another type of consequence there or another type of strategy to help them stay in bed. Like maybe you just ignore the jumping on the bed until the child lies down, and then you give them lots of reinforcement and praise for lying down. Or you might take away another privilege. If you don't lie down, you won't have any screen time in the morning. Okay, so we talked over all of the 8 different parts of how specific timeouts work according to the research, what is more and less effective. Now we're going to talk about how to keep timeout appropriate for specific unique families. This could be your family. This could be a family that you work with. So we're going to talk about different cultural components that we want to consider, and also developmental things, how timeout works differently for different kids at different stages. So culturally, in the parenting research, there are values that come up a lot. And these values could be things like respect for authority, interdependence, how different cultures demonstrate affection to each other, how multi-generations are involved in parenting practices, and how much of culture values reinforcing positive child behavior. And so you want to think about how timeout is going to fit in with your values or the families that you work with. And you can just ask them, how important is it to you that your child respects your authority? How do you guys usually show affection? So that way, you know, going in, how to kind of explain and include this in their larger goals. So the research shows that if a child considers any type of parenting practice to be normative, so it's common, it's normal in our family and our culture, it's fair, and it is a sign that you care about me, that you love me, then those practices, regardless of what they are more successful, and they have fewer negative outcomes. And so collectivist culture, oftentimes cited as East Asian cultures as an example, but their goals of their society and their values put greater emphasis on the bigger group, the society as a whole, over the importance of the individual. And so collectivist cultures, according to the research, tend to see more strict obedience as more important because it elevates the goals of the larger group. Whereas individualistic cultures, Western Europe is cited as an example there, the values are more geared towards you're responsible for yourself and your family only. And so those cultures are going to see all those different values differently. So just kind of having those conversations with people is important. And people from minority cultures within the US, living outside of the US, according to research, tend to see timeout as more American practice. And so because of a lot of the bad patterns and mistreatment that's happened in the history of the world, sometimes parents from minority cultures, from outside of the US, will view any parenting practices that are taught by somebody like me with distrust, rightfully so. And so we need to be sensitive to that, have conversations about that, and help engage them to discuss how this may fit with their values, despite it being a prototypically Caucasian American parenting practice. With that said, we do need more cross-cultural research. Just like across research, minority cultures are underrepresented and therefore undervalued. And so because the majority of this research has either been done on Caucasian, ethnically European populations, or it's just flat out not reported, a lot of these specific component of timeout research from 40 years ago, they don't even cite what types of demographics they're studying. And so we do need more research on that. However, all of the research on larger parenting programs and packages like PCIT, we do have a fair bit of data for all different types of cultures, and those definitely have been disseminated around the world. And so we do have effectiveness numbers for those, timeout as part of those treatments. And so with timeout specifically, we do have studies of Japanese families, Australian families, Chinese, Swiss, New Zealanders, Norwegians. And then in this study, this is from 2000, so it's 20 years ago now, but we do know that there are no differences in how often families are using timeout across cultural groups in the United States, except that it was used less by Spanish-speaking Hispanic parents. And we have a study showing that, or multiple studies showing that Native American and non-Native American families in the US found timeout to be acceptable equally. We know for immigrant families that the longer that families are living in the US, the more likely they are to use timeout, and that it is used less by low socioeconomic status families. And the thought here is that because these families tend to use corporal punishment, physical discipline more often, it's about safety. And so I like to think about how often I have ever used any physical discipline with my child, to grab them when they're running into the street, or if I yell or lecture. I don't love those practices. I don't really believe in those as strong parenting tools. However, if my child is in a dangerous situation, I'm way more likely to yell at them, "Hey, get back here," and grab them and pull them back. And so in these low socioeconomic environments where there's a lot more dangerous activities, that may be one of the reasons that timeouts use less. Okay. Then developmentally, we want to make sure that kids are at least 24 months of age or older equivalent. So cognitively, they understand their language abilities for understanding are at that level. There actually have been studies done for younger than that, but we want to make sure that we have more research to show that that's effective before that would be a good choice to do. Another reason for aiming for kids developmentally 24 months and older is because younger kids are having more of their behavioral issues, if any, because of they have immature communication skills. They don't understand cognitively the reasons why things happen in the environment as well. They don't have that learning history, and they need their parent a lot more to help them regulate. So it's just not recommended for kids younger than 24 months to use timeout. We can help them learn how to follow directions, though. We're just going to praise and clap and get excited when they follow the direction rather than trying to give it a consequence. And so for kids younger than 24 months, we use other strategies like taking that object and putting it out of reach, or picking up the child and moving them out of a dangerous environment. Larger kids, so on the other end of the developmental spectrum, larger kids may need an alternative backup for refusing timeout and escaping from timeout. So like I talked about before, you can't physically carry a lot of larger kids. And so we need to have another backup, like you're going to lose points on your chart, or you are going to lose access to a special privilege if you don't go to timeout. We want to include older children in our planning when we are using timeout with them. So if you've got an 8 or a 9-year-old, if you can talk to them about what's in it for them, like your parent's going to stay more calm, or you're going to get in trouble less often, it can really get their buy-in to help them want to cooperate with timeout. And there is some evidence that timeout can be effective for kids older than 10, especially kids with developmental delays. We just want to make sure that they're not experiencing it as unfair, as babyish, and that they're able to get themselves to timeout on their own without being carried. So now we go into the hot button issues, the controversial ethical and legal issues. There's so many different arguments out there. If you would type this into Google, you would have a lot of reading to do. But I just first want to talk about the word punishment. So just like positive reinforcement sounds like it means good and fun, but really positive in behavioral science means adding something. Punishment is a behavioral word that has been turned by the lay public to mean a lot of things that it's not scientifically intended to mean. So B.F. Skinner in 1953, who is one of the very first behavioral scientists, defined punishment as a procedure involving either removing reinforcement or introducing what he called an aversive stimulus, so something that you don't like. And the result of that is decreasing a certain behavior that depends on it. So if I hear this kid blowing this noisemaker in my house, and I say to him, that hurts my ears. I need you to stop. And he blows that thing less in the future. Technically, that was a punishment that I just did. I added something aversive, something that he didn't like. He didn't like to be told that that was hurting my ears. And so he did it less. So I punished it. The behavior happened less. So that's a punishment. Another example, if these two kids are fighting and I say, if you two are going to fight and put hands on each other, you're not going to be able to play together at recess. So I separate them. And then the next day at recess, they don't fight, or they fight less because they want to keep playing together. I technically punish that. So I think sometimes we think of punishments as being harsh and cruel and evil and bad, but punishing just means you're doing something and making that behavior happen less the next time that the child has that opportunity. So with that being said, I'm going to address a number of hot button questions that come up a lot. I'll go through each one of these individually and talk about the research behind them and just some common pitfalls and why these things should be considered from different angles. The first one is probably the most prominent, and this is probably my most important point I want to make in this whole presentation. People say, doesn't timeout cause trauma and physiological harm? So one of the triggers and starting points for this whole conversation was there was an article in Time magazine published in 2014, and it was titled, "Timeouts Are Hurting Your Child." And in that article, they cited a study that said that the brain experiences timeout as suffering and isolation similar to physical pain and abuse. So that's really scary. As a parent, you don't want to do a strategy as part of your routine week to week that feels like physical pain and abuse to your child. That's horrifying. And so the article that they were referring to was a scientific article published by a researcher named Eisenberg in the scientific journal called Science in 2003. And what they actually showed in that study was that the same areas of the brain and patterns in the brain were found both when a person's feeling physical pain and when other people didn't throw a ball to them in a virtual game. So these research subjects were playing a virtual game on the computer. And when virtual characters chose not to throw a ball to them and kind of excluded them from this ball throwing game, the same parts of their brain lit up as they would when you're experiencing physical pain. So basically, when you feel upset, when you feel left out, your brain doesn't like it and it feels uncomfortable. And so Dan Siegel, who is a psychiatrist and professor and researcher, and then Tina Bryson, who is also a therapist and researcher, who were the people cited in this timeout article, "Timeouts Are Hurting Your Child." After the timeout article was published in Time, they actually issued a clarification. And they said the title, "Timeouts Are Hurting Your Child," was used without their permission. They didn't like that title. They didn't want that used. They said that the article had misrepresented when they compared timeout to physical abuse in the brain. And these two authors even said that they are, quote, "all for appropriate timeouts." And they define that as using timeout calmly and infrequently. And they even cited research supporting the positive use of timeout. So even this very controversial article that came out, the authors issued a clarification on it saying that that's not correct. So with that being said, to underline all of that, there is no evidence of trauma or re-traumatization from timeout. Never once been a single study showing that that was true. And I think a lot of times we get concerned about timeout for populations of kids who do have a trauma history. They've maybe been abused or been neglected before. And so we worry about putting them in timeout because we don't want to make things worse for them. But actually a calm, consistent program of discipline, like using a timeout, can actually help them have less anxiety and less trauma symptoms. There is research showing that even children with abuse and neglect histories, when they're used as part of a larger parenting relationship with lots of positive components to it. When those parents use timeout calmly and consistently and properly, it leads them to have fewer trauma symptoms and less anxiety because it's very predictable. So this is definitely a myth, this question here. Second question, aren't there other negative outcomes associated with timeout? People will say, if I use timeout, my child's never going to learn to problem solve, or they're not going to be able to express their emotions, or they're actually going to become more aggressive, and the environment in my home is going to become really negative if I use timeout. And so we want to clarify here that timeout is not meant to, quote, think about what you've done. The point of it is to stop a misbehavior. And so you can discuss why that behavior is right and wrong at other times. The point of that timeout is not to explain all that stuff to them. You are absolutely welcome to discuss that about why hitting hurts others, other strategies that they can use instead of hitting, or instead of, refusing to follow directions or running away from their parent in public, or whatever the behavior is that you're trying to treat with timeout. But you are removing the option of hitting because you're physically separating the child and putting them in timeout. So when they have that option off the table, they are much more likely to use other strategies. So if they're right now, I'm communicating to you, I don't like that, and so I'm going to hit you for it. Now, when they're not hitting anymore, they're going to use other strategies that maybe you have taught them, and they just have a higher chance of doing those things. Same kind of idea with emotional expression. It's best to model how to express your emotions in a healthy way, to label child's feelings for them, to discuss their emotions, regardless of if you choose to use a timeout or not outside of that. And so a timeout shouldn't make a big difference about how well they're able to express themselves. You're just kind of taking that inappropriate expression, whether it's yelling or swearing or whatever behavior it is, off of the table so that they can focus on the other more adaptive strategies. The question of aggression, increasing aggression, the only truth to this is that you can have what we call a brief extinction burst if you are targeting aggression. So if you are using timeout to try to decrease aggression, for, in my experience, maybe a day or two, when you're putting in a new timeout procedure, you can see more hitting than you did before. And basically, that's the child kind of testing the limit and just figuring out where this new boundary is. But after that, timeout is shown across all the research to decrease aggression and to decrease parenting stress across the household. So definitely does not increase negativity or aggression in the long term. Okay, so we have all these research studies. It's efficacious, meaning yes, it'll work in this squeaky clean clinic with these perfect conditions, but does it work in the real world? And we know that when it is done properly, it definitely works in the real world. And properly means it's got to be done infrequently. We don't want 100 timeouts a day. It's got to be done calmly. So we're not going to yell and shame and say negative things while we're doing it. It's got to be done predictably. So picking a specific behavior or behaviors that we use it for. And then we don't want to give a lot of extra attention during it. And so when families do it that way, it works very, very well. Sometimes families don't use it properly in the real world because they've never been trained on all of these things, because there's a lot of myths out there. And even then, sometimes it's effective. Like, I think the reason that we've all heard of timeout is because a lot of people use it. And even if you're not doing it perfectly, it can still be effective. If it doesn't work, it's probably because we're doing something about it incorrectly, or if there's really severe behavior issues going on, kids with oppositional defiant disorder, kids who are extremely aggressive, kids who have developmental delays, who need a different approach, then those parents can be trained to do a more therapeutic type of timeout where it's very detailed and specific on what we say and do. And that is done in the real world. It's taken home and used for years and years outside of therapy. And we also know that even if a parent doesn't do that perfectly forever, they can still be effective. Doesn't timeout only affect immediate behavior problems? Like, yeah, it might stop her from hitting right now, but what about in the long term? Again, we know that there are longer term outcome studies of families who have used timeout versus who haven't used timeout. And it is linked with all kinds of positive outcomes, both on its own and as a part of these behavioral parent training or larger treatment packages. Again, we're using it as part of, I'm a broken record. We're using it as part of a larger positive parenting approach with good relationships and good attention going on and healthy activities there. But we can link outcomes of all of these programs that use timeout to better academic success, better mental health, less incarceration, less substance abuse, better relationships with peers and authority figures and parents. And I mean, it just goes on and on and on. So no, it does not just affect immediate behavior problems, because when we can use it effectively, kids are better adjusted. And to kind of go along with that, people will say, isn't exclusively positive parenting preferable to timeout? There's all different types of names for what we count as exclusively positive parenting, basically parenting without any type of discipline, and or I guess any type of consequences. And there is a ton of research out there from Dr. Baumrind, and it shows that parenting styles that have high levels of warmth, which, yes, exclusively positive parenting does have high levels of warmth where you're sensitive, you are providing a lot of attention, you're warm and caring. But we also know that we have to have high levels of control. So the best type of parenting with the best outcomes is considered this authoritative parenting, where you have that really warm relationship and you have high levels of control and discipline. So you can get your kids to follow directions quickly. They know where the boundaries and limits are, and it helps keep them making healthy choices. So there is no research that exclusively positive parenting is effective, slash any better than authoritative parenting or parenting that uses consequences like timeout. And so we also kind of question how lots of families can complete exclusively positive parenting. Like, it sounds very nice and warm, but never giving any consequences might just not be a realistic for most families. And then they could fall into this permissive parenting category where they don't have a lot of discipline and control, and we don't have great outcomes for kids who are raised by permissive parents. Isn't timeout widely unacceptable? So we know, based on a study that I cited earlier, that about 70% of US families report using timeout for children. And specifically, this survey was 19 to 35 months, so about a year and a half to 3-year-olds. So 70% of people were using this all the way back in the year 2000. We have some data that families from Norway, New Zealand, and Australia have reported concerns in the research that timeout would seem too harsh or be perceived negatively by some of the families that they work with. And so we talked before about how collectivist cultures and low socioeconomic status families tend to view harsher practices as more acceptable and use them more. But overall, most studies that were cited from around the world, most families prefer timeout over physical punishment and rate it more acceptably. And they also prefer positive reinforcement over timeout. So if I can give you a prize, tell you good job, give you a special privilege for doing something, and that changes your behavior, I would rather do that than put you in timeout any day, is the general consensus. Okay. So those are some of the ethical issues. Now we got to talk about the legal issues. 2 legal issues that come up a lot, and this you're be thinking about, like, in hospital settings, childcare, school, and even in your home, your rights as a parent. Um, One is seclusion. It's a legal word. It usually means something like involuntary confinement of an individual to a room alone in which they're physically prevented from leaving. And then we've got restraint, which is involuntarily limiting an individual's freedom or physical movement. And so here's two examples of restraints we use all the time in our society. We use car seats and high chairs, and they're physically prevented from leaving. So technically that's a restraint. And so these laws are in place to prevent safety concerns, and it makes a lot of sense. We don't want childcare providers abusing their power and restraining kids for long periods, cruelly, in inappropriate ways, and those things definitely happen, and that's why we have those laws. We also have a lot of research showing that solitary confinement in prisons, or chemical restraint, so giving somebody a medication to sedate them, just to control their behavior, can have a lot of negative outcomes. But in our situations, we're using a parent as a decision maker for their child, and so I'm never putting a child in timeout. The parent is always doing it. And so parents make lots of decisions for their children all the time. They choose what school they go to and what type of food we're going to have available and whether or not to give vaccines. And so I would argue that we need to do some type of moving kids and putting them into safe things like car seats when it's their safety and when it's their healthy development at stake. But sometimes the laws are the laws, and whether or not you agree with them for every single situation, we have to follow them. So finding out what the laws are in your area and your setting. Some modifications that we use to still be able to get the positive effects of timeout without breaking any rules. One example is this half door. So lots of institutions will allow this because the child can see the parent in there. They have access to the sprinkler system in case of a fire. And then we'll just have the parent hold the door closed for, a minute so that the child has that timeout, but they could leave if there was an emergency and they're safe and comfortable. Another option would be to remain in the room with your child so that they're not alone, they're not secluded, and you'll just kind of turn your back and not respond to talking to them so that they're getting a timeout from your attention still, but they're not alone. Another option would be just removing the toys or removing a privilege until the child complies with the timeout so that they're still having a timeout from a positive activity or timeout from your attention without being restrained or without being isolated. So the bottom line is that timeout is effective according to research. It is safe. It can be tailored for most families in most settings, and it is one tool in the toolbox. It is a contrast from the positive attention and relationships that we have with our kids. And so if our positivity and our healthy relationships are this high and we've got our timeout is this boring, that contrast is what teaches the lesson. It's not about shame. It's not about guilt. It's not about thinking about what you did wrong. It's just about experience the difference between this is all the fun and excitement that I usually have, and this is the fun and excitement I have in timeout, and I'm going to choose this and do behavior that I need to keep doing to keep in this environment and avoid going to this boring timeout situation. Okay, so again, I can't tell you what to do, but according to all the research, there are a lot of positive effects that timeout can have on children and families and their development all around the world. So if you would like and you're interested, there is a YouTube video. I'm not going to play it now because we're almost out of time, but you can search. This is the title on YouTube. It's under my YouTube channel, and it's actually a two-parter, but it shows how we give a timeout, roughly following the PCIT protocol, but it also follows all of the recommendations that I talked about today from the research as far as location and warnings and timings and all of those things. So I'm not going to play the whole thing, but you can see a piece of it. All right. Thank you guys for coming. I know I talked for a long time, and so we're almost out of time. Lindsay, I don't know if we want to do questions.
Yes, there's a couple of questions in the chat. If you can see them, I can read them out to you, or you might be able to see them now that you've stopped sharing.
Yes, I can see them. Is there evidence on what is most effective to do or not do after timeout ends? In PCIT, all of our evidence shows that if we return the parent's positive attention immediately, we don't talk about what you did wrong and why it was bad. We want to create that contrast. So timeout was super boring, and now that timeout is over, you completed it, you're going to get a lot of praise for your positive behaviors. I'm going to respond to things that you're saying. I'm going to use a lot of enthusiasm and even positive touch, hugs and high fives. That makes a big difference. Good question. Do you know if there is any research on timeout and pathological demand avoidance? There is not any research on those two things together. I know pathological demand avoidance is a hot topic now, and I am not an expert on that. And I don't know that there is a lot of research on that. So sorry, I can't answer that one. Could you speak to PCIT with kids with autism? Yes, so I've done some research on this topic. Cheryl McNeil, my co-author, has a whole book all about it. It's getting a lot more research attention. It's showing effectiveness for kids who have level 1 and level 2 autism. There's not as much, if any, effectiveness research on level 3 autism. So you want to think about those developmental considerations we talked about. Can the child understand the directions I'm giving them? Are they able to tolerate some of the situations that we talked about? And other than that, tailoring it can definitely be done. Ooh, somebody said PDA is not a thing. Pathological demand avoidance, shots fired. I'm not gonna speak to that one. Do you know if there's any research on, oh, there's another question about that. What is the address of your podcast? Gosh. I don't have a podcast. There is one on the Sanity podcast that I was a guest on about PCIT and then older child protocol. That the podcast is just called Sanity. Any suggestions how to keep timeout calm on a child who likes to do self-harming behaviors? Yes, that's very, very tricky. There's all kinds of different ways we can handle that. We can do shorter timeouts to try and help get them complying with the timeout and completing it, but without giving them a chance to get into some of that self-harming behavior. And that's a longer conversation there, but that's a tricky one. Okay, I think I know there's other questions, but I think we're almost out of time. Thank you guys all for being here.